My name is Allison Quinter. I am a 2022 St. Joe's alumni. I currently work for Pillar ABA, which is an applied behavior analysis agency. My role is administrative director, so I like to consider the role somewhat threefold. The majority of my responsibility at Pillar ABA is really ensuring compliance with the Pennsylvania state law for applied behavior analysis services. And so with that, what I do is I create policies and procedure both for staff and for our clients to ensure that we're not only in line with the Pennsylvania state law for services, but also with the insurance companies that we are providing services with. So that's arguably the most important part of my role. In addition to that, I do all of our human resources oversight, which means that I do our hiring processes and our onboarding processes for staff and interns. In addition to that, I also do our client intake. So I get to see our clients come into the door for services, really help families navigate whether this is the most appropriate level of service for their child, and then get them set up. So a day-to-day can look very different for me depending on, what the status is with new clients, what the status is like with new staff, and then, of course, overseeing policies and procedures. In the beginning of the month, I'm very audit heavy, which means that I'm ensuring that, any policy we do have in place is being followed by the company. And then from day to day, I'm connecting with new clients and new staff members to get everybody set up for services. So like Scott mentioned, I was an undergraduate psychology major. I had a minor in behavioral neuroscience and a clinical concentration. And my anticipation was always that I wanted to go on to a higher level of education right out of my undergrad. That was my initial idea. And my sophomore year of college, COVID hit, and that kind of changed the course for me. And I decided, I don't have a firm grasp on where I would like to go next or the kind of program that I would like to do next. And so from there, I decided to take the knowledge that I had from my prior experiences at St. Joe's and my internships, which I'm sure I'll talk about in a little bit, and kind of take what was in my wheelhouse and apply that to getting into the workforce. So previously, I had worked in the human resources department at St. Joe's for all 4 years of college as an HR intern, and that built up a lot of experience for me on doing things like employment verification, and really getting a good idea of what the hiring and onboarding process looked like for staff. So when I started my career search prior to graduation, I came upon this job at Pillar ABA and noticed that there were really a lot of aligning things between my experience, in that human resources department, and then also the connection to wanting to ultimately go into the clinical field. So I landed on this job because I wanted to be in a clinical field of psychology, kind of get that oversight of what clinical operations looks like, but also to apply what I had learned previously from my job experiences and internships. I think there are a lot of surprises that I've encountered working in this field. First and foremost, applied behavior analysis is not a field that I had much exposure to, personally, professionally within my education. And so along the way, although I'm not a clinician and I don't do clinical work, I have learned a lot about the field of ABA, which has been really unique to me. Like I mentioned, as somebody who initially anticipated into going into a clinical level of care, learning more and seeing the day to day of our clients and services has been really intriguing for me. I would say, in addition to that, I have learned a lot about what it takes to really provision therapy services, which I don't think is something that a lot of people think about, especially those that are, receiving services themselves or are thinking about a career in the therapeutic realm. I have learned, I know the state guidelines in and out for services, which has been really unique. Ultimately allows us to provide the most ethical, efficient, and effective level of care for our clients, which is super important. But something that I really underestimated prior to coming into this field and knowing what the regulations looked like. So my first real job was on campus, as I mentioned, working in the human resources department. I had gotten the opportunities for that because of a connection that I had to another student at the time who shared the opportunity with me. It was part of the work study program. And so I applied for it, interviewed for it, and ended up being there for the full 4 years I was on campus, which was really great. And then I also partook in the psychology internship course whereby I interned at PB Ministries, which is a skilled nursing facility. And there I had the opportunity to shadow the staff psychologist and go around room to room with some of the clients that she was seeing. My ultimate thank you, if I could go back during that time, was, you know, the connections really make a difference. And it doesn't matter if it's, something like an internship, something like a job fair. I would recommend to anybody to go out to make those connections because you really don't know where those connections can take you in new experiences. I mean, the opportunity that I had with the HR department, that opportunity was introduced to me from somebody that I knew from high school who no longer even worked on campus and had graduated a couple of years prior, but still was able to make that introduction between me and the department. And same thing with my internship opportunity. Without those connections, I don't know how I would have found those opportunities. Although opportunities are always prevalent, always take advantage of making those connections and also investing in those connections because you never know whether that'll lead you to your next career opportunity. For me, at least during my time at St. Joe's, I had a lot of personal connections that worked in my favor. I like to consider myself rather lucky because those connections just were able to play out the way that they did. But I think on a level of professional connections, I think it's really important to take advantage of some of the platforms that are out there. I know a lot of times the Career Center will talk about the importance of creating a LinkedIn page, which in my head at the time, I was like, this is just another thing that I have to keep track of. I don't want to do this. And I actually didn't create my LinkedIn page until after I graduated. And now looking back, I wish I had done it a lot sooner because it really will allow you to make the connections with other individuals. I mean, I can speak for myself, and I'm sure others would agree. In the professional field, there are a lot of people that will reach out to me on LinkedIn, kind of just curious about my career path or curious about the field. And professionals like that are really excited to answer any questions that you may have. I think that's a great starter. A connection does not have to be somebody that you know personally off the bat. That's the point of a platform such as LinkedIn, where you're able to connect with professionals in the fields that you're interested in, and just being able to reach out and asking more questions about a career, a field, a job position that you might be interested in to gain more knowledge is really beneficial for you in the future. And then following up with them, thanking them for their time, checking in at later dates for additional opportunities. Things like that can really go a long way, I've learned now being out of college and into the professional world. I love this question because any opportunity that I have to share the mission statement at Pillar ABA is an opportunity that I'm going to take. At Pillar ABA, our mission statement is treating every individual as a whole person. And so typically when I explain this mission statement and the backstory of it, there's a lot of things that come into play when we're talking about services and we're talking about employment. I think that mission statement doesn't only pertain to the individuals whom we're providing services to. I think that also pertains to our staff. And a couple of things that go into that mission statement, at least from my perspective, are things like cultural competency is very, very important for the services that we provide. We provide an evidence-based practice, and in our services, we're going out into the field working with individuals in their homes, in their schools, in their daycares. And so to enter somebody else's realm and provide naturalistic services, we have to be extremely aware from a client perspective of, what is the individual's culture? What is the culture of the environment that we're working within? To the point where it's prevalent in our intake forms for all of our clients. It's also prevalent during the assessment stage where our behavior analysts conduct an assessment with our clients. They will take a considerable amount of time learning more about the background of that family. Now, that's how more so it applies to our clients, but the same goes to the expectations for our staff. Our staff are consistently taking cultural competency training, as well as having the opportunity to really share their personal culture with the group. And I think that is extremely important, because what it does is it promotes non-discrimination in services and promotes non-discrimination in employment. And so those are just a couple of things that we've done. We host a professional development day within our agency every year, whereby all of our staff will come into our center and partake in, different levels of programming. And again, more so client directed, but also an opportunity for our staff to share, what their professional experience has been and more about their personal cultures, being a company that promotes cultural competency. Now, I'm fortunate. My first answer that comes to mind, somebody did tell me, one of my professors, Dr. Anastasio, told me this. And kind of like I had discussed a little bit, I was so dead set on going a certain schooling path after I graduated. And I think that students find themselves in that mindset of, you come into college with this idea of what you want to do next before you've even gotten through college. And we are almost having our brains trained to make that next step into our next level of education prior to getting through these 4 years that we have here at St. Joe's. And so one of the things that Dr. A had told me, and she was my advisor at the time, is she said, you don't have to know exactly what you're going to do next. What you need to do is take opportunities that are exploratory for you. And that could be anything. That could include internship opportunities. That could include clubs and activities. That could include things such as making connections on LinkedIn, like I talked about. I think that something I wish was more emphasized to students is you don't have to know exactly what you want to do next. In addition to that, you can take that first job as an exploratory opportunity to see, okay, this is along the lines of what I would like to do, or maybe adjacent to what I'd like to do, and start out there. You don't have to stay in that job for 5 years. You can try out something else, go back to school. There is no set path that anybody needs to take when going through their career journey. And like I said, I think that is something that I wish was emphasized heavier. And fortunately, I was lucky enough to have an advisor who shared that with me off the bat, that I didn't have to do this dead set route. I would say the number one thing that I would recommend to students is really take time to pursue an internship opportunity. I know at St. Joe's, or at least it was when I was there, had the, experiential requirement where an internship was part of a course. And so I didn't only take that opportunity to get credit. I really wanted to see through that internship experience is if, I would like to go on for further schooling. I would like to pursue that next step. And so what I did in that experience is I found a licensed psychologist who I was able to shadow with her clients. That taught me several different things. One, it taught me, I really like to do this. This is what I would like to do, but now is not the time for me. Two, I did shadow the psychologist in a skilled nursing facility. So it was a very different population than I had anticipated I would ever work with, being that I really wanted to get into adolescent psychology. And it also taught me that I love the geriatric population, and that therapy in the geriatric population was really interesting. So my first piece of advice is really try to obtain an internship that is along the same path of what you're looking for. Or if you have doubts about it, but you need that experience to clarify some of your concerns or next steps, invest that time to find an internship that fits your needs. Rather than, filling your resume with things that are not benefiting you to prepare you for that next step. I think it's extremely important to find something that aligns with what you'd like to do, because that's the point of an internship. I would say that's probably my biggest piece of advice. Second to that, I again reiterating making connections. I know I went through my whole spiel with LinkedIn before, but I can't emphasize how important it is to put yourself out there to connect with people. That could even look something like practicing interviews for a job, for an internship, even if you're not going to pursue it. Put yourself out there and make that connection and work through the interviewing process so that you have experience for the future. There are a couple that really stick out just as far as what I was interested in. And I think, helped geared me to, again, is this really what I want to do? And is now the time to do it? One that I can think of off the top of my head was psychological assessment. I found that course extremely fascinating. It taught me more, again, about the behind the scenes of services. And now I think back to that course a lot when I think about what I see at my job. We do have a center where clients come in for services. So I get to see what it looks like for our staff to interact with clients and go through assessments with clients. So from a psychological perspective, that's really interesting to me. I would have to add as well clinical psychology, because I think I learned a lot about the different domains of psychology and what different levels of therapy looks like, which ultimately, again, helps me determine, do I want to take this next step to go into that? I will throw in there too research methods and statistics, because a huge portion of applied behavior analysis services, I see Dr. Stats clapping, a huge part of applied behavior analysis services, and a quick plug for anybody who is not super familiar with ABA services, is data recording and measuring outcomes of client services. So that has really helped me understand the level of service that we provide, which I think is really important, being that person that is front and center for an agency who speaks with clients on a daily basis and speaks with staff on a daily basis, to have a good understanding of, the why behind what you're doing for your job, even if you're not the clinician performing it, is super important. So I think I would tie those courses in directly to not only my work that I perform now, but also that path that I took to help me discover what my next steps in life would be. I think the first thing that I would touch upon, being now that I was just talking to Dr. C and Scott about, it's almost been 2 years since I've been at Pillar ABA. So I started here prior to graduating from St. Joe's and have been here ever since. And I think that something that really came up as I was nearing the end of my senior year was that rush to apply to jobs. And it seems like everybody around me at the time was applying to all these jobs. And I felt like that was what I needed to do at the time. That's how, I did end up starting at my place of employment in April prior to graduation. But I say to students all the time, I think it's really important for you to take the time interviewing for as many opportunities that you see become available. There's no need to kind of have that rush just because you feel the pressure of everybody around you, setting in and applying to jobs and going on interviews prior to graduation. Yes, I think it's great to start thinking about your next move. Absolutely. But at the end of the day, you need to find the right fit for you, and taking time to do so is really important. And also, put your eggs in multiple baskets. Apply to a bunch of jobs. Go to interviews. Gain that experience along the way, because it's only going to serve you better when you go through the system the next time. I would also say, in addition to that, aim high. Always aim high. I think that something that I've learned being on the hiring end of a career is a job that you see listed that you might be super interested in might have certain qualifications that you need. Now, obviously, if you really need a master's, level credentials to do that job, then that's probably just what you need to do it. But I found that a lot of companies are extremely willing to work with students fresh out of college, just because, we are very eager to learn. We're eager to get into that first job and to participate, pick up on new things. I can say myself that I really enjoy working with college students and those who are fresh out of college, because I think that there's a lot of motivation behind the work that's done. And we are a generation of very hard workers. And so I think that aiming high will never let you sell yourself short when you're in, the job process, or even if you're applying to schools, to go back to schools, aim high. I think that's the best thing that you can do for yourself personally and professionally. So kind of as I've hinted, or I guess haven't hinted, but shared already, the mission statement at the agency that I work for now is to provide services to treat every person as a whole. I think that when I saw that mission statement, and that's another thing that I would recommend for students, always take a look at what the company's mission, vision, and values are prior to, applying. Familiar yourself with those things. One, it's a great thing to bring up in an interview and to connect to your experience and your values. But two, it really will give you a good idea of, what the work environment will look like working there. I think that companies that take their time to share that mission are companies that are living out that mission every day. And that's proven true, at least in my case with my current agency. The reason why I actually ultimately ended up deciding to apply for this job, which is really funny, is I looked into the company mission statement, having no idea really what applied behavior analysis services were. I looked at that mission statement, and the first thing that it reminded me of was the Jesuit values of being part of a community that's with and for others, and providing a level of service that's with and for others, however you may take that. That is something, between my agency mission statement, but also it's the Jesuit values and the Magis, is something that I carry through my daily job. Again, I'm not a clinician myself, so I don't work with our clients, but I always bring myself back to how can I apply that mission to what I'm doing? How can I better serve the community that I'm working for? And it just so happens to be that, the mission statement for our agency is very similar to that of St. Joe's. And I think that, being a St. Joe's alumni, I have been instilled with a lot of those values of how can we serve the community and population around us. For me, that's not just limited to, the community in the area that I work in, but also the population of individuals on the autism spectrum and their families, and how can I provide resources. So again, bring it back to the question, I think that the Magis is something that has been instilled in every one of us Hawks. It's something that we think about on a daily basis, something that our professors have highlighted on. And I know personally it's very important to us as a community. And I think it's extremely important to find, take that next step to find a company that aligns with that mission. Carry on the legacy that you have built at St. Joe's and take it into your next opportunity. Again, from the jump start, take some time to really get a good idea of what the position entails that you're applying for. Get a really good idea of what the company stands for prior to going into an interview. I can speak from, my personal experience, but also professional experience of interviewing others, that when a candidate comes in the door who is knowledgeable about our services and about us as an agency, it really sets them apart from others who may be applying. Second thing, this might be a little, surface level, but I know that St. Joe's and the Career Center has really done a great job of preparing St. Joe's students about this. Your resume, it is going to be the first thing that any employer goes to. They're going to take a look at that, and almost within seconds, they're going to make their decision of, is this a rejection, or are we going to move along to a second interview? So something that might seem very redundant is actually really important in just getting an interview set up. Then, like I said, preparing to understand what the company stands for, what the position stands for, what is it entailed in it. I think in addition to that, just really having a great idea of your why. Why are you applying to this job? How has your previous experience applied to why you're applying for this job? A lot of questions that you'll get in interviews pertain to, tell me a little bit about your prior experience or your understanding of this field, which is a really broad question. And so if you take some time to think about that, come up with, a 30-second elevator speech of every time I'm in an interview, this is what I'm going to practice so that I can share, with the interviewer. That way you already have it memorized. It highlights on anything that might be, pertinent to the job you're applying for, or the opportunity you're applying for. And you kind of don't have to go through that stress level of, oh my goodness, this is my first interview. What am I going to say? How is it going to go? If you walk in there confident and you have your 30-second elevator speech memorized, that's really going to put you on a good start to the interview. And then from there, it'll flow a lot more naturally. You'll ease some of the anxiety, just going into the interview and thinking to yourself, what am I going to say? So I guess those couple of things. Every interview looks different. And so just maintaining that professionalism and confidence while you're interviewing with that individual, again, is really going to set you apart from other candidates.
So what's the difference between management and ABA and hands-on work with clients?
Okay, so pretty straightforward. I, being in an administrative role, do not provide clinical services, whereas those who are behavioral health technicians, registered behavior technicians, or board certified behavior analysts, those are the individuals who are assessing their clients and then also provisioning ABA services with their clients. So I do not provide clinical services. I do oversee our clinical services. So really, I find this the most unique part of my job. I get to read all of our clients' treatment plans, which, being somebody who has a more clinical brain, I really enjoy. I enjoy seeing kind of where our clients are at developmentally. Now, again, I don't have much to do with that aside from, sending it out for signatures, submitting it to the insurance companies, and the not so fun aspects of the job. But aside from that, that's really all I oversee clinically. And then again, those other staff members are trained to work with our clients, implement the treatment plan, and then also do data collection for the behaviors and skills that are being worked on with our clients.
What jobs can you get with ABA? Who would you recommend these jobs for? And what qualities or interests should someone have looking at a career in the ABA area?
Sure. Now, like I mentioned, specifically in the field of ABA, there's a couple different positions that are available. There's a behavioral health technician, which is really the introductory role into the field of ABA. The behavioral health technician works one-on-one with our clients to implement the treatment plan with them. So half of it is being that one-on-one therapeutic support for them, but also collecting the data while in session. A registered behavior technician is an individual who pursues the credential, which essentially means that they go through a series of training, they do a competency assessment with their supervisor, and they ultimately sit for a board exam to become registered. That can be done by anybody who does have a high school degree or higher. And then the master's level for the field of ABA is the board certified behavior analyst. The board certified behavior analysts, or we call them the BCBAs, what their role is to assess our clients, determine what level of need is identified. From there, create a treatment plan that identifies behaviors that need to be reduced because they're maladaptive, or skills and goals that should be acquired because they're developmentally appropriate, or skills, that are appropriate in that environment for the client. And then the behavior analyst will come out to supervise their clients and the technicians that are working with the client to ensure that the program is running smoothly, to take a look at the data that is collected by the technician to see if there has been progress made in those respective domains. And then also provide caregiver training to families, teachers, others that are included in the client's treatment. Let's see. Who would I recommend this job for? So I love this question because I make the joke when I'm in interviews with interns, and our agency, Pillar ABA, has an internship and a fellowship. An internship is for any individual who is pursuing, an undergraduate degree in psychology and has interest in this more clinical domain. But I meet with a lot of interns for our internship, and I make the joke that I wish ABA was something I knew more about when I was undergrad, just because like I've mentioned multiple times, I really wanted to go into a clinical field and I wanted that feel for providing a therapeutic service to clients. And unfortunately, there isn't too much leeway within psychology to perform services with clients without having a master's degree or higher even. So I always consider ABA the one exception because a behavioral health technician at entry level does not need to have any formal degree aside from a high school diploma or equivalent. And so that gives you a really good feel for not only what a therapeutic relationship looks like with clients, but also extending it to and this is more so, the psychology domain, learning more about what clinical note taking looks like, learning how to, write an overview of a session, which is what any therapist, counselor, psychologist who is seeing patients would have to do. So building upon those skills. So as far as, that entry level experience, I would recommend anyone who is interested in the clinical field of psychology, really to get a good grasp of whether that's the route that they want to go. And even, is this the population you want to work with? Is this the age group that you want to work with? Do you want to work in, an office or a center-based setting, or do you want to work out in the environment? Again, I think it's all exploratory. So if it's something that you are intrigued by, it's a great opportunity to take. I think that ABA answers a lot of questions about, next career steps that individuals have. And then as far as what qualifies or interest would someone have for ABA career, and somebody else mentioned this in the group chat as well, which I can touch upon more personally next. A lot of individuals who come into this field have an interest in the autism population, and that's where their service kind of begins. I make another joke that everybody that I have met that's been in this field has really done ABA as an exploratory opportunity, and in that time has fallen in love with it and ultimately decided to take that next step of becoming a registered behavior technician or becoming a behavior analyst. And I think that that really speaks true to this field, the population that we work with, and the services that we provide. So it really depends on the individual. Again, it's an exploratory experience if you're doing it as an internship or even as a first job. And so if it's something that does pique your interest because you want to know more about how ABA works, what it feels like to work with a client, I think that it's a great opportunity out there.
Thank you for that. You definitely touched on all of those, which is wonderful. So Grace asked, have you ever done any work at the Kinney Center at St. Joe's?
Funny enough, I have not. I have not worked for the Kinney Center, and looking back, it is an opportunity that I wish that I took, and I highly recommend for any individual, who may be interested in going into the field of ABA to get that experience on campus. Now, from my understanding, I think the Kinney Center does a great job of preparing students for what ABA, strategies are, what vocabulary looks like within the field, although they aren't necessarily providing all of the qualifications for ABA services. I think it's a great jumpstart to, work with that population. I myself did not work at the Kinney Center. But again, something that I wish I would have taken advantage of to get more experience with the population that I do work with now.
Right. Are there other questions? Either can come into that. Yes, Professor C.
Hi, I have hopefully a quick one. Thank you so much, Allison. That is so just insightful. It almost sounds like we paid you to say some of these things because we say the same thing, but it just has so much more impact when you say it from your experience. So I guess one question I have for you is I think a lot of times students come into psychology, they're interested in the clinical concentration, they're really interested in the clinical aspect of things because that's kind of what we know. It's sort of the most obvious part of sort of wanting to be engaged clinically. So I think it's really cool that you're working at an agency where you're able to kind of engage in kind of work in the clinical realm without actually sort of necessarily hands-on, one-on-one with the client. So I was wondering if you can sort of talk a bit more about sort of what are some of these other kinds of opportunities that students may not kind of even be aware of because they just think of like, oh, therapy, that's what you do. So if you can help shed light on that, that would be great.
Yeah, absolutely. That's a great question, Dr. C. And a question that I probably would have had myself as an undergrad prior to transitioning into this role. Um, like I mentioned, a huge part of what I do at my agency is, I mean, it's a little bit of everything. It's oversight of policies and procedures, it's oversight of client intake, and then oversight of human resources. Now, in my experience with other providers, there are so many positions out there that may fall more so along the administrative lines for services, but again, have a little bit of clinical oversight. So you're kind of, taking a peek into what the clinical realm looks like while pursuing another opportunity. Or if you really don't have that fascination with the clinical side of things, what it looks like on an administrative side of things. A couple things that I can point out would be, a case manager. The role of a case manager is really to assist a family in getting the level of services that are most appropriate for their child, and really acting as the family's advocate in that process. I've seen a lot of agencies who will hire more so for service coordination, which I think service coordination is a really unique field to go into, because again, you're getting the exposure to individuals within the field. Even outside of applied behavior analysis, you're getting exposure to individuals, learning more about what their diagnoses are and kind of the process of getting services started, helping them, to achieve those services through authorization, which I will spare you the details of that because insurance sometimes can get a little boring, in my opinion. But I think that a lot of the administrative roles that are open within the field of psychology are really great for individuals who want to connect with the community and want to kind of lead with that service-driven mindset, because what it'll allow you to do is connect to families, make the connections in the community, help, learn more about the service process in general, but also connect those individuals to receiving services. So at least from my perspective, a lot of what I've seen is, outside of the clinicians, is more so those administrative roles. Aside from that, there are tons of opportunities, and that's to say too that a career after your degree in psychology doesn't mean that you have to apply that directly to being at an agency that provides psychological services. You could work possibly in a human resources department at some other domain. I think the one big thing that I've taken away from my education at St. Joe's is that my education is highly universal and something that allows me to connect with other individuals in the environment solely because of the background that I have achieved. So that's to say, like I mentioned, it doesn't just have to be in the field of psychology. You can apply your degree to other fields as well, maybe other fields that you also have a dual interest in.
Thank you so much for that.
Yeah, I think we've done it. I think we've filled our time. Please, everybody, join me in thanking Allison for joining us today, providing such great insight into her career. Allison, we are so grateful for your time. We certainly hope to see you back on Hawk Hill sometime soon.